Okay, so now we have Angela laying prone or face down, and the airbag is just right underneath her lower abdominal area. This is also to exercise the multifidus and the transverse abdominis, the core stabilizers of the spine. One thing, since she's a woman, I will mention this. Probably 70% of patients in a clinic will be female, and they will have low back problems. And the majority of them, if they have had a baby before, will have urinary incontinence. And so pelvic floor issues are very related to poor core stabilization. Those muscles are actually tied into the pelvic floor, which goes right up underneath the crotch and supports urinary continence. And so there are a lot of women, when they sneeze, laugh, make them, tighten up their abdomen. Sometimes they'll lose a little urinary control. That's especially true as they get a little older and they've had more babies. So this is a great exercise to help women, and most of them will never want to talk about that because it's kind of embarrassing, of course, but there is a connection between urinary incontinence and core stabilization issues. So this is the exercise. She's going to try to move the needle through this range by tightening her abdomen and applying just a little bit more pressure and controlling the needle to move through those different ranges. So she's actually trying to increase the pressure just a little bit. So I'm going to hand that to her, and there's nothing really exciting about this. It's kind of like watching paint dry, but it is a helpful exercise as she can move through that. Try to apply a little more pressure, and she should hold it for 10 seconds at each color and move through them, and then she can come back down. Okay, can you get it to go a little higher? She's having a little hard time getting it to go higher than that. So there we go. There you go. Excellent. Now she's getting it up there. She holds it, comes down a little bit. You can hold it for 10 seconds at each level. Okay, come down another level. Keep coming down. There you go. Excellent. So she does have pretty good control. She had more trouble on her left side than her right side, and that would be picked up more on the back than it would on the abdominal exercise. But this is the other half of that multifidus transverse abdominis exercise.